Well, good afternoon. I'm King County Executive Dow Constantine. Harborview Medical Center is one of King County's greatest assets and one of the nation's premier public hospitals. Owned by the people of King County, Harborview has been operated under contract by the University of Washington for 45 years. Harborview admits nearly 20,000 people per year and accommodates almost 65,000 emergency visits. It's also a training center for doctors and nurses and medical staff who serve communities across our state. Harborview is home to our region's only Level 1 adult and pediatric trauma and burn center. The UW Center for AIDS Research is here, and a host of world-class medical and surgical programs call Harborview home. The extension of this contract that governed this arrangement was set to expire at the end of next month. Some might have wondered if the tides of change, monumental and accelerating change in the healthcare field, might sweep across our shores, and the pressure of market forces might dislodge Harborview's place providing service to our public. But an outcome like that would have been devastating. I am so pleased to be here today to announce a new management agreement between King County and the University of Washington and the Harborview Medical Center Board of Trustees. This long-term agreement will extend our partnership to serve the people of King County well into the next generation. Most importantly, this agreement ensures that Harborview will continue to provide the highest quality care to patients from all walks of life, regardless of their ability to pay. Harborview has come a long way from its humble roots. In 1877, a dozen years before Washington became a state, Harborview was founded as a 6-bed King County hospital in South Seattle. In 1931, it moved to its present location overlooking Elliott Bay, and its name was changed, logically, to Harborview Hospital, now Harborview Medical Center. Through UW Medicine's management, Harborview has become a leading academic medical center, and new facilities have been added using voter-approved bonds and reserve funds. As the county's public hospital, Harborview has also always emphasized service to what's known as its mission population. Lower-income residents who don't have health insurance, those who need mental health treatment, victims of domestic violence and sexual assault, non-English speakers, and others. This agreement affirms that commitment to serving those who have the greatest need. The benefits of this agreement cannot be overstated. First, this agreement grants Harborview patients benefit of UW Medicine's integrated delivery system. Our mission population gains access not just to Harborview itself, but to the services of a robust, sophisticated care system that UW Medicine has built over many years. Second, this agreement strengthens the governance of Harborview. The Harborview Board will exercise greater oversight and greater independence in the areas of budgeting, capital planning, and reporting to the executive director. The president and vice president of the Harborview Board will gain seats on the board of UW Medicine, enhancing the coordination between the two entities. Third, the agreement helps the county address the ongoing crisis in the provision of essential public health services, including in county public health clinics. By formalizing our long-standing partnership, we can ensure that our mission population continues to have access to these services in the most appropriate and most cost-effective setting. This agreement, for the first time, includes specific agreements by the university to maintain access to core medical services needed by our mission population, including primary and specialty care, diagnostic services, and inpatient psychiatric care. And perhaps most importantly, this agreement looks to the future and enables Harborview to better adapt to changes and new challenges in our rapidly evolving healthcare environment. Those challenges include expanded healthcare coverage eligibility with increased competition and new models for service delivery and for reimbursement. We as a region benefit enormously from having one of the world's finest research universities right here in our community. As King County Executive, I have the enviable opportunity to take this research and apply it to the work we do as a regional government every day. It was the groundbreaking neuroscience produced at UW's Institute for Learning and Brain Sciences that inspired me to create Best Starts for Kids, the initiative that voters approved overwhelmingly in November. Now we're strengthening our partnership to achieve the same goal with healthcare. Soon, new branding for Harborview will be unveiled to better represent our renewed partnership and our shared identity. But today, we celebrate securing the best provider and partner we could hope for as the operator of King County's public health hospital. Before I hand the microphone to President Kause, I want to thank her personally for her leadership and for the leadership at UW Medicine who made this agreement possible. I'd also like to thank the Board of Trustees, especially Board Chair Clayton Lewis, for helping craft this agreement. It's now my pleasure to introduce to you the President of the University of Washington, Annemarie Kause.
Thank you very much, Dow. It really is an honor for me to be here this afternoon. This agreement ensures that UW Medicine will continue to provide excellent patient care to all, including those that are most sick, most in need, most vulnerable, for many years to come. It also strengthens our partnership with King County by expanding access to care in critical areas, by integrating our shared governance structure, and ensuring that Harborview remains a leader in the rapidly changing healthcare environment. I look forward to supporting this agreement at the UW Medicine Board and recommending final approval by the UW Board of Regents next week. University of Washington Medicine's long-standing relationship with Harborview and King County is one of the university's most impactful community partnerships. We're proud of the world-class care that UW Medicine physicians and healthcare staff provide to thousands of patients every year, including nearly $60 million in charity care to some of our most vulnerable citizens. Harborview is more than a place where you go when you're really sick or when you have nowhere else to go. Harborview is a perfect reflection of who we are as a university. As an academic medical center, UW Medicine physicians and staff at Harborview train the next generation of healthcare professionals. They discover the next big innovations in patient care. Over our 45-year partnership, UW Medicine physicians at Harborview founded Medic One, Emergency Response. They refined treatments to improve the survival of patients with severe burns, and they pioneered less invasive and more effective ways to test for brain trauma. This impact is impossible without the 4,500 UW Medicine doctors, nurses, technicians, and administrative support staff that serve Harborview patients every day. It's their dedication to this place, to its mission, and to our citizens that built Harborview into one of the best healthcare facilities anywhere. And so I want to thank them for their work and their service on behalf of the university. I also want to thank the UW negotiating team for their fabulous work on this agreement. Jonice Spichzel, Lori Mitchell, Elise Chayette, and Randy Hodgins. Without their work, we wouldn't be here today. And last but not least, thank you to the county executive, to county council, and to the county negotiating team for their work on this agreement and for their ongoing commitment to this partnership, which is so important to all of us and to all the citizens in this county. So I will hand off now to Council Member Dombrowski.
Thank you very much, President Kause. Good afternoon. My name is Rod Dembowski. I serve on the King County Council representing North King County. And for more than a year and a half, I have served on the Harborview contract negotiation team. I'm joined here today by King County Council President Joe McDermott, the chair of our Health, Housing, and Human Services Committee, Councilmember Jeannie Cole-Wells, Councilmember Larry Gossett, chair of the Law Justice Committee and a long-standing supporter of Harborview Hospital. We are in Councilmember McDermott's district, and I would just like to say a few words from one of the negotiating team's perspective. I'm really thrilled to be here as we announce this landmark agreement. It's an agreement that lays the foundation for the next 3 decades of partnership between the University of Washington and King County. As our county executive pointed out, this Harborview hospital has its roots way back in 1887 in a 6-bed hospital that the county started and is representative of the county's more than a century-old commitment to ensuring public health here in King County. It's very personal for me, and I know about the county's commitment to public health because as a kid growing up in King County, I didn't have health insurance, and my primary care was delivered in one of our public health clinics. It's also very personal for me to be here today because my dad, frankly, sees today because of the work here at Harborview and its eye care clinic. I've delivered him here for surgery, and he drives and travels and gets to see his grandkids today because of the tremendous work that goes on here today. So this work has been personal for me, and it's really a tremendous result that we've got to be here today. In most areas of the country, county hospitals are considered refuges of last resort. Many times the last place you want to go for medical care. Harborview Hospital, Harborview Medical Center is the exception to that. It is the first place that every resident in King County, and frankly many in our multi-state area from Alaska to Montana to Idaho, want to come for traumatic care because, frankly, we're the best. President Kause mentioned some of the innovations that have been developed here. Medic One is a big one and represents the best in partnership between UW-Medicine, King County, Seattle Fire. You mostly probably know the story of Medic One, but as a result of that, we have the best record in the world for surviving cardiac arrest right here in King County. Not the best in America, the best in the world. And it's because of a partnership between the University of Washington, Harborview, and then Seattle Fire. King County has taken that region-wide, and it's one of our most successful services. I think the county executive mentioned our Center for Sexual Assault and Traumatic Stress. It was established here in 1973. It, too, is one of, if not the best in the country at what it does. I've met with their leadership last year. They were instrumental in helping the county advance our work on testing all untested sexual assault kits. They see over 500 patients a year, 500 visits a year come to that clinic for the care and expertise that they deliver. Just briefly, in July of 2014, the County Council adopted a motion knowing that the current agreement was going to expire, and it set forth the principles that we wanted to see in the new agreement. And the county executive mentioned some of those, but they are commitment to our community, strong governance, strong financial stewardship, independence of the hospital while strengthening our partnerships, valuing Harborview employees, environmental stewardship, and health care that is fair and just. And after 30 meetings, I think that I've had, and many more that our staff have had, today's agreement captures and embodies all of those principles. Just a few highlights if I can. As the county executive and President Kause indicated, and I think you'll hear from Clayton Lewis, this agreement ensures that on a go-forward basis, our most vulnerable populations will continue to be able to receive the best health care in the county right here at Harborview, whether they can pay for it or not. And we've expanded that commitment as our target and mission population has diversified out of the downtown core countywide by strengthening our partnerships with public health and UW-Medicine to be able to make sure that our public health clinics continue to be strong and functioning. And that's a very important new partnership that's embodied in this agreement that I think offers a very, very promising and exciting results for the future. Valuing our employees, I mentioned that. This agreement has very good language in it to make sure that the folks who deliver on the mission here at Harborview are treated with respect, and I'm very excited about the new opportunities for partnership there. Just by way of example, it ensures that the workers at Harborview are entitled to and will receive the same training that any other worker at any other UW Medicine System hospital gets. It's a great commitment on behalf of the University of Washington. It represents the best in what the UW stands for, so thank you. On governance, we're governed by a board of 13 trustees. President of the board is Clayton Lewis, who's here. We're joined by my nominee, or my appointee, David Baker, who's the mayor of Kenmore, a registered nurse. He's here today. They do a tremendous job, day in and day out, governing the hospital, running the hospital. There's language in here that ensures that they'll be able to continue as a very strong and independent board. I just want to thank personally, on behalf of the council, President Kause and Clayton Lewis for their personal investment and commitment in getting to this deal. It's been a long negotiation. It's complicated. There are a lot of unknowns in today's healthcare environment. Things are changing very rapidly, which makes it very difficult to do a long-term deal. This deal is flexible, but this deal also will deliver on our commitment to taxpayers. It's a strong foundation for the future. It's a good deal for county taxpayers. It's a fair deal for our most vulnerable populations, and it's the right deal for everybody at the table. Thank you.
So my name's Clayton Lewis. I'm president of the Harborview Board of Trustees, and the board is a volunteer group of individuals, and we're appointed by the county executive, appointed by the members of the county council. And it's an honor to serve on that board. I've been on that board for 10 years. And in that time, we spent a lot of time looking at hospital systems within the state of Washington, within the Northwest, within the nation. And what's extraordinary is that the partnership we've had with the University of Washington, with King County, has resulted in Harborview being the crown jewel of the medical system, not only in King County, but within a 5-state region. And as trustees, David Baker, the other trustees, we're out in the community, we hear 4 things from the citizens of King County. So one, it gives them peace of mind that we have the adult and pediatric trauma and burn center. And not only do we have it for the residents of King County, but imagine if you live in the state of Alaska, the state of Montana, the state of Idaho, you're going to be flown here because of both the extraordinary and very unique quality of care you can get here if you need that level. Now, the secondary benefit for the citizens of King County is that we've created what we call centers of excellence that offer expertise that, once again, is available nowhere else within this 5-state region. In sport and spine, orthopedics, vascular, neurosciences, the Eye Institute, all of these clinics, we have people flying across the country for elective care at Harborview. Now, another thing that we hear a lot of confidence in is the fact that Harborview is in charge of disaster planning and also execution of any disaster plan. And so I talk to citizens across the county that have a great deal of confidence and peace of mind that we put a lot of energy in planning for disasters. But what's most important and what's most critical, and you'd hear it if you talk to any of the amazing employees that are here today or walk across to any of the buildings, people at Harborview are 100% committed to providing this extraordinary care to every individual without any regard for ability to pay. And that's really what I think brings heart to the trustees, brings heart to the elected officials, and is so passionate represented by the employees here. So we're grateful for that. This agreement's interesting in that it's a 10-year contract with 2 10-year opportunities to extend the contract. So it could represent 30 years. And as we were having the conversations, as we were thinking through this agreement, we were trying to contemplate what healthcare might look like in 30 years. And of course, that's impossible. And so the work that this agreement represents is a framework that clearly delineates the responsibility of the county, the responsibility of the University of Washington, the responsibilities of the trustees, and it gives us a framework to march forward and to continue to do an extraordinary job of serving individuals from all walks of life. And with that, I'd like to invite Councilmember Gossett to share his comments.
Trying to let all these students come out of class. My name is Larry Gossett, and I am not going to repeat, just hopefully echo the comments that everyone who has spoken before me has made. I just want to add a personal note. I had the opportunity to serve as one of the 4 King County Council members that was on the negotiating team with the university and the hospital leadership group, and I am extremely happy and proud that we have come to this agreement because of what it means to King County Hospital and Harborview's historic mission population, the poor, the disadvantaged, the folks that have the most difficulty getting adequate health care in our community. It has primarily been this hospital that has provided that. The reason it's personal to me is because I think I'm the only one up here, I'm not sure, that was born in King County Hospital to parents who were very poor, had just moved up to Seattle from the South. And today, many East African refugees who are coming to Seattle and, like me, living in the housing projects, High Point and elsewhere, are going to continue for the next up to 30 years to have access, even if they're not able to pay for it, to effective health care. Nothing could be more valuable and better. So I'm going to conclude, because I can feel when somebody's at my left saying, that's enough time, bro. And we also thank all of you for being here with us. If there's any questions later, I'll be here with the others to answer. Thank you.
And now, Councilmember Cole Wells.
Thank you very much. It's really wonderful for me to be here with you today as a newly elected King County Council member after many years as a state senator. It's really a privilege for me to think about being able to vote on this historic agreement on the King County Council. Also, as a longtime adjunct faculty member at the University of Washington, I'm really excited about our being able to have the contract go ahead with the University of Washington. As a faculty member, I taught courses mainly on educational equity and sociology of the family and women in the social structure. And I learned also from my teaching how important health care, really excellent health care, is to individuals from across the spectrum, all walks of life, and that's what all people can obtain here. Now, this long-term agreement benefits not only residents of King County, Seattle, but also our whole state and the entire Pacific Northwest, and at times even individuals who are brought here from other parts of the country. And these are individuals who are struggling with sexually transmitted diseases, trauma, victims of domestic violence, sexual assault, and many other types of medical conditions. It's also personal to me very recently, although I've always known about the excellence of Harborview Hospital as a trauma center for the Northwest. A partner of a family member of mine was brought here in December with very severe burns. And she had thought she should go to another hospital on First Hill. And she was informed that if she had been taken there, they would have transferred her to Harborview because this is the place to come for burn trauma. She received excellent care and she pulled through. So the other important thing for me, and this is from my academic role, is that the University of Washington is the #1 public university in the entire country to receive federal research grants. #2 overall, but #1 public universities. And as such, we know that a bulk of that, or a majority of the federal grants, go into health care and new innovations. So it's really important that we have this new Harborview Huskies partnership with our new contract and being able to continue very important traditions that have already been established. As new chair, I should say, of the Health, Housing, and Human Services Committee for the King County Council, I'm looking forward to working with the University of Washington, with the board here at Harborview, to continue this outstanding relationship. I next have the privilege of introducing Janice Spiso, Chief Health Systems Officer for the University of Washington Medicine and Vice President of Medical Affairs.
Well, thank you so much, Councilmember Cole-Wells. I'll be brief with my remarks this afternoon, but wanted to really conclude with words of thanks and appreciation for everyone who helped with this process to finalize this agreement between King County, the University of Washington, and the Harborview Board of Trustees for the management of Harborview Medical Center. It was clear that the most important thing for everyone was ensuring that world-class healthcare continue to serve the mission population and patients from all walks of life, and that Harborview remain a vibrant resource for our community. Our UW-Medicine staff and physicians working at Harborview take great pride in delivering patient care, not only with great expertise, but also with compassion as well. Lastly, I'd like to thank everyone who works at Harborview for their commitment and mission focus on caring for everyone who comes through the doors of the medical center. I've been here for 22 years, and I can personally attest that each and every day they place the needs of our patients first and deliver this outstanding care, every patient, every time. They know their reward every day is that they're making a difference in our community. So thank you very much.
Well, thank you, Janice, and thanks to all of our speakers. Before I ask for questions, I just want to make sure that I also thanked the members of the county negotiating team who put in so many long hours to bring us to this day. Patty Hayes, John Gerberding, Kendall Moore, Rachel Celebrisi, Patrick Hamaker, and my chief of staff, who unfortunately was not able to be here today after working on this thing for 7 days a week for a couple of years, Sung Yang. But we should thank him and thank all of them. And now we'd be happy to take any questions you might have. And I've nominated Clayton Lewis because I nominated him to the board when I was on the county council to take the lead in helping us answer them. Please.
I'm Deborah Horn from Cairo TV. I wanted to tell you that a couple of minutes ago I talked to someone from SEIU. And when I talked to the union in December, they were very critical of the University of Washington and Harborview Medical Center, saying there weren't enough people working here and that their staffers were being asked to take on onerous burdens. But I got a surprise when I talked to the president of SEIU. She called this a new day, a sea change. How were you able to reach that kind of conclusion in less than 2 months to get here today?
So first, at the trustee level, we are not engaged in negotiating the contracts with the labor unions, and that's very specifically authority that we delegate to the University of Washington as part of the management contract. What I would say at the trustee level is that we're actively engaged in listening, asking questions, and looking at one of our pillars, which is to be an employer of choice. We were very happy that last Monday, the members of the union had the opportunity to vote and to ratify the new contract. And so we reached agreement last Monday, and so it's wonderful to have reached agreement last Monday with the members of the union and then to be presenting this contract today for consideration by the Board of Regents and the County Council.
Well, perhaps Councilmember Dembowski then, because they said that they were heard from, and that was something that they never felt before. They never felt that anybody was actually listening to their voices in negotiations, and they talked about this agreement in particular, that it has language they've never seen before. Do you want to come into the microphone?
Well, thank you, Deborah. And that's been a partnership, a value that was set forth in the council's motion, a value that was shared by the county executive, that was shared by the Board of Trustees, and shared by the University of Washington. And it took more conversation and more dialogue, and I think that that is the result you see today. But there is real language in here about protecting and giving workers at the hospital a fair shake. I mean, these are workers who, when the ducks crashed on the Aurora Bridge, turned around and came back to Harborview and worked without compensation, worked over hours to serve this community. There is no doubt that we have the best workforce in healthcare on this hill, and they wanted to be partners. It's no doubt, I think, that there were contract negotiations going on and things can get tense, but those are resolved and the partnership is strengthened and the agreement ensures that it will be on a go-forward basis. So it's great to hear those words of support from Ms. Sosny.
So patients can feel confident that the care they believe they were going to have at Harborview, they will continue to have.
We wouldn't be signing this unless everyone up here felt that.
So as they say on TV, thanks, Debbie. Other questions? Well, I want to thank you all for being here. You know, you may say, why are we making such a big deal of continuing a partnership that has existed for 45 years? But to craft a contract that will lead us through decades of the unknown in one of the most complicated fields you could imagine, and to protect the interests of the poor here in King County, protect the interests of people in the entire Pacific Northwest who are seeking trauma care. That was a tough, tough job, and I salute everyone who helped bring this agreement together. Thank you so very, very much. Thank you.